We were talking in relation to the epilepsy on the World Epilepsy Awareness Day, which falls on February 14th of 2022. Epilepsy is a disease which is treatable in many situations. However, there is an entity called uncontrolled epilepsy, which is about 25 to 30% of people, where there is either a genetic abnormality leading to a kind of a syndromes or a severe structural abnormality of the brain, either during developmental abnormality or an acquired abnormality, can make the epilepsy resistant to the medical treatment. When we try adequate dosage of the medicines, inadequate combinations for an adequate period of time, still if the epilepsy is not getting controlled, we define this as uncontrolled epilepsy. All these people need to be investigated extensively to find out the reason for the epilepsy, the abnormality that exists in the brain, the location of the abnormality and its relation to the normal brain, how much it is affecting the quality of life of an individual, and what are the possible options for the treatment. Now, if there are severe genetic abnormalities, it is very difficult to control some of the epilepsies, except possibly in future we can have some gene editing which is likely to be possible. Whereas in all these conditions where there is structural abnormality, direct evaluation of and removal by the surgery is the most appropriate treatment. Once you remove the irritant or the cause, and the epilepsy will either subside or will come under control with medication. Now, there are certain situations where the epileptogenic area of the brain is extensive on both sides, where no medication can work and no localized surgery can help. In that situations, we have few options where we make a surgery called corpus callosotomy, where the electrical disturbance that crosses from right to left brain and vice versa can be disconnected so that the person will not fall down losing consciousness. Thereby, we can manage the falls, injuries, etc. Similarly, there are other surgeries where we can extensively disconnect the brain wherever the abnormal electrical activity is generating, can be disconnected to the rest of the brain so that the epilepsy will remain focal and they will not lose consciousness and fall down. Now, in an uncontrollable epilepsy, you not only have to take medications but also have to be assisted all the time of the day, so that any time they will fall down, they will injure and they cannot lead an independent life. And with so much of medications, they will be sometimes very drowsy and needs assistance even for the daily chores. So this is the advantage. Once we reduce the severity of the attacks, the medications can be brought down and then the quality of life can be improved. Another important newer development is the vagal nerve stimulation. We put a stimulator to the vagus nerve, and then it has got two options. It will also sense when the epilepsy is going to come. So immediately it will try to activate itself, and so that the severe attack will be averted, and it will also control the number of attacks. So that without any major surgical procedures, with a very simple procedure, we can control the severity of the attacks, frequency of the attacks, and the intensity of the attacks, so that we can reduce the medications and improve the quality of life. It is very important in that such resistant epilepsies to bring down the number of attacks for the simple reason that each attack is going to create certain amount of permanent insult to the brain. So this is the whole idea, is to reduce the ongoing damage, support the brain and protect it, and reduce the minimum medications so that we can improve the quality of the life of an individual.